what are the biggest barriers then preventing AI from being adopted widely in like global health research?
So on a few we touched upon already. I think it's the data privacy concerns, regulatory restrictions, then also the fact that across the globe, those things are handled differently, right? Going from Germany to the EU to the US, we have sometimes the same laws, but always different interpretations of it, which it makes it challenging. Then it is much about quality of data. Data is really, if you take the data out of real world, you need to spend quite some energy to get it into good shape, if you can do it at all, due to missing variables and data, due to the, let's say, different context they have. You need to fuse them. So this is also challenging. Another point is that the data is often very siloed. So across the healthcare system, many, if not all, key stakeholders have their own data piece. Yeah, so we have some data, the insurance companies have some data, the physicians have some data, the hospitals. And to bring them together, a lot of infrastructure is needed to really do this and excel this. Yeah, but these are, I think, the main things that we work on, but they require some energy to be overcome. Yet it's doable, and we are doing it. I think we're on a very good path and need to go forward. If you then transfer it from clinical research into integration, which is ultimately what you want, right? You mean you need to have your findings and your things, but in the end of the day, you want to have them applied within the routine care. And here are other challenges that come up, especially that it needs to fit into the clinical workflow, which is super important. And then again, we are talking about infrastructure challenges.
I think we touched on this before. Like, there's so many different variables, isn't there, with healthcare? Like when I lived in the UK, I got like ankylosing spondylitis, and I was having to take an injection every 2 weeks. But then since I've moved to Spain in the heat, it's eased the pain, and then now I don't need to take it. Obviously, you can't use the same data in each location, can you? You've got different variables because
absolutely
different living standards, different ways. And obviously, heat, like it just shows that makes an impact. So I guess that he digs deeper into the health data, doesn't it?
That's a fantastic example, and glad to hear that your move to Spain was also in this regard successful. This is what I meant before, also with context a little bit, right? You really need to make sure you know in which context, in this case also meaning in which location, the data has been taken. Yeah. Data can easily fool. You need to have really good and close look, and here it's important that you also have interdisciplinary teams that look at those data, because a data scientist on his own usually can only do a part of it. Yeah, you need then the clinicians, you need the experts who can tell you what the data actually means, where there might be some caveats in it. So absolutely.